Thank you, fabulous. So, we also have Dr. Stephen Chen, a dentist, that will be coming up here to talk about what he's going to do.
This is the...
That's forward, yep, and you can even do that. Yeah.
Okay, thank you. Good morning. Well, in 5 minutes, I'd like to make that mouth and body connection with you. Many people tend to think that the mouth is not that connected to the body, but actually, 80% of what happens wrong in your body originates in your mouth. In fact, if you have chronic illness, things like autoimmune diseases or cancer, the first thing you need to do is actually clean out your mouth of inflammation, infection, even toxic materials that are placed in your mouth. This should be cleaned out first before you even clean your internal organs. So in this next slide, I'd like to show that the tooth is actually not just a solid material, but there are fluids that run through it. As hard and durable we think of enamel is, it runs through it some really microscopic tubules that connects with millions of other tubules that permeates the dentin. In fact, there is a connection between the enamel to the dentin and to the nerve endings and the blood vessels that's at the center of the tooth. There's constant nutrient exchanges through the fluids from your body that flows through your blood vessels into the tooth, out your dentin and into the enamel. This is what determines the susceptibility of your tooth, whether it's going to decay or not, because the nutrients is brought through the surface to constantly repair the surface of the tooth as it gets damaged by the acids in your mouth. That saying about what happens in Vegas stays in Vegas? Not so true in your mouth, right? Because it's ludicrous to think that the mouth is not connected to your mouth, to your body. It's whatever happens there, it could easily go anywhere in your body through your blood vessels and through your lymphatic system. For example, in our practice, I have a case here where there's on that first slide up there, there's a failed implant that on one of my patients, and we had to remove that implant and replace it with another implant and then fix that bone. But as you can see on that bottom picture, on the far left of that picture is the new implant with nice bone around it. All this happened under 4 months with the help of the Beamer. And I have another patient who has, going back. Uh-oh. Sorry about that. All right. This patient, as you can see, the one with the root canal there, there's an infection in the root canal, and it's a failed root canal, as we can see. But the patient does not want to have it removed because it's part of a bridge. So all we did with her was to do Beamer once a day, because it's all she can do, to come to the office 3 times a week. And in 7 months, you can see that the bone actually healed up around that apex there. And she is no longer feeling any discomfort. And I'm proud to report to you 2 years later today, that is still the case. She has not had any recurrence. So people ask me all the time, what do I do with Beamer in my dental practice? Well, I can show you that these are the different types of things that we use it for in the office. Take note of that so you don't keep asking me. So it really helps, and we put the mat or the pad over the B-body over the patient in our dental chair. But many times, because I'm a whole body dentist, I also have a wellness center next door My wife, my lovely wife, who's a nurse of over 40 years, is in charge of that place. But I oversee all these patients, and we put them in that center for a better environment away from the dental drills and sounds, so they can relax. And we use them to lower their blood pressure, so I can do surgery on them. And then we send them back over there so that they start healing. And that's it for my presentation. Thank you.